Hi there, my name is Dan Wood. I'm a professor of urology here at Children's Hospital Colorado and UCHealth. I moved here from London a short while ago, and the reason for moving was to be involved in formulating a service around transition of kids from childhood care through to their adult care. Transition is about trying to get a child to engage and assume their independence in the healthcare setting. It's really important for them to understand what's happened to them before and to become the key decision maker in their own healthcare. Our team will be there to try and support them through that process and build a care approach that will see them into lifelong care through their adolescence and into adulthood. So who's it for? Well, it's mostly for the kids. Sometimes it's about helping parents to understand the need for that transition, the need for their child to develop their own responsibility and independence in healthcare. But it's also for us, the healthcare team, to make sure that we completely understand what's gone on beforehand and the care that somebody's likely to need as they get a little older. We'll see a whole range of different kids with all sorts of diagnoses and all sorts of things that have happened to them in childhood. We see patients who've had posterior urethral valves, bladder exstrophy, spina bifida, cloacal malformations, so a range of different situations with a range of different surgeries. And it's really important that kids are involved in services like this. It's important for them because it means that they get the lifelong care that they need. It means they get the follow-up that they need, the blood tests that they need, the scans they need, and any treatment that might follow on from that. It's really important that we can incorporate other specialists into their care so they get a true multidisciplinary care, much like they would get in through their childhood care. Sometimes kids go on to develop complications as they get older, bladder stones, urine infections, changes in the reconstructions that they've had that don't necessarily grow with them in the way that we'd like. And when that happens, we're there to help with managing that. So the service exists in some forms here, and there are lots of people working alongside myself and other members of the team to make it happen. But what I want to do is consolidate that in urology and look to build partnerships with other teams so that transition is there for everybody that needs it. What we want to do is ensure that we have long-term patient engagement and the best possible care that a patient can have, not only in childhood, but through their adolescence and into adult life. The other things that we want to do are make sure that we maintain a database to understand all the patients that come through and watch them. We can then use that data to feed back the outcomes that we see and really start to establish an academic program here. We want to establish the service here in Colorado as a reference center so that we can look at those outcomes and also start to train other professionals in the type of work that we're doing. Some of that will be medical trainees as they go through into their fellowships, but also others such as specialist nursing staff alongside that. Ultimately, the aim is to provide excellent care for kids who are growing up in this local area, but also to look to build a safe service that will cater for patients nationwide. Thank you for taking the time to watch this short video. I hope it's provided some useful information for you. If you want to know more, or you want myself or my colleagues to see patients, then please contact our department. We're based over at Children's Hospital, but we'll be seeing patients not only there, but over at UCHealth too. Thank you for watching.